undergraduate program about tobacco cessation and smoking behaviors. Tobacco companies formation from small units to big multinationals. If you remember, those days, tobacco companies used to sponsor all our sports activities on TV, on national TV and radio, but now they are banned, okay? The real drive was when the cigarette making machine was invented. 40,000 hand roll compared to 4 million by a machine per day. So they were just making cigarettes every day, like making sweets, okay? And advertisements, of course, I told you just now, it was used in TV advertisements and also radio, and they were the main sponsors for our sports activities. We move on. Smoking is the #1 public health problem. Why? It is a leading preventable cause of premature death and disease worldwide. Not only involves oral health, but our general health. It affects our heart, our lung, our skin, our oral health. It is the main risk factor for many non-communicable diseases. It causes damage to environment because of passive smoke. It is a source of financial burden because if you are going to smoke 1 packet of cigarette a day, is going to cost you between 15 to 20 ringgit, depending on the trademark of the cigarette, the brand of the cigarette rather. Tobacco use is the leading preventable cause of death in the world and kills up to half of all lifetime users. That is serious, right? Why do you want to smoke? It kills you. The tobacco epidemic is one of the biggest public health threats in the world that has ever faced, okay? And killing more than 8 million people each year. So it is a worldwide problem, not only in Malaysia. More than 7 million of these deaths are the result of direct tobacco use, while around 1.2 million are the result of non-smokers, which we call passive smoking, or rather they are exposed to second-hand smoke. Over 80% of the world, 1.3 billion tobacco users live in the low and middle income group. So you see where the money goes? It all goes on cigarette and it all ends up in smoke. So according to the Malaysian Ministry of Health, tobacco use in Malaysia accounts for 35% of the in-hospital deaths. That's a lot, right? According to the census, and principally from cancer, heart disease, and stroke. So like I told you, tobacco just doesn't influence oral health, but it has ill effects on cancer, heart disease, and stroke. More than 10,000 Malaysians die from smoke-related illnesses every year. Factors which increase risk for smoking: parental and other family members smoke, less connectivity to family, school, and society, ready availability of cigarettes. As you see, if you walk into 7-Eleven, the last thing when you do when you check out at the counter are cigarettes on display. Peer pressure. When I asked one of my patients the other day, he's 23 years old, he smokes 15 cigarettes a day. Why did you start smoking? Because of my friends when I was in the university. So peer pressure, you want to be fashionable. Advertisements, influence of media, concern of overweight. So when people smoke, they lose weight, but that's not the way to lose weight. Please go to the gym. The chemicals in tobacco harm many parts of the body: skin, mouth, teeth, and throat, lungs, and heart. If you notice, our skin loses moisture. It becomes dry, and we look old. Effects of smoking on health, heart disease and stroke, cancer, oral cancer, lung cancer, skin cancer, chronic obstructive pulmonary disease, or we call it COPD. Pregnancy gives rise to low birth weight and premature births in women who smoke during pregnancy. Evidence also shows harmful effects of smoking on oral health. There is an association between smoking, precancerous conditions, and oral cancer. Increased severity of periodontal disease, where there is loss of teeth, and the negative influence of smoking on the success of certain of our surgical procedures or treatment, such as periodontal therapies, surgical treatments, removal of third molars or wisdom tooth, placement of dental implants are at risk if you are a smoker. So the treatment is not very successful if you are a smoker. In recent years, it has been shown that smoking may increase the risk of illnesses related to endodontics and periodontitis. Endodontics, as you know, is root canal treatment. So if you smoke, there is reduced blood flow to the gums. So periodontitis is a result of that. Smoking and oral health. Smoking leads to dental problems, including bad breath or halitosis and tooth discoloration. I have a lot of patients who come into our clinic complaining that my teeth are stained, my teeth are yellow, they are not as white as it should be. Should I do tooth whitening? I don't think so. I think you should stop smoking because the tobacco stains your teeth. Increased risk of developing gum disease or gingivitis or periodontitis, and causes tooth loss. So premature loss of teeth is due to periodontosis or periodontitis, okay? And delayed wound healing, like I explained just now, it follows tooth extraction, periodontal treatment, or oral surgery. Lower success rate of dental implants. Now everybody is going for implants. Nobody wants to wear a denture, which is removable. Implants are rather fixed, but the success of your implant surgery depends on your smoking, or rather on the general health of your oral cavity. So increased risk of developing oral cancer is also due to smoking, and mouth cancer or oral cancer is the third highest incidence in the world. There is extensive and consistent evidence showing that the harmful effects of smoking on oral health. As you can see, premature loss of teeth, and the patient has to go on to wear a denture. There is association between smoking, precancerous conditions, and oral cancer. Increased severity of periodontal or gum disease. The precancerous lesions are erythroplakia, leukoplakia, and white lesions in the oral cavity, and an ulcer which is non-healing for more than 2 weeks. And together with alcohol, it has a synergistic effect. It actually speeds up the oral cancer. Smoking might be a risk factor in certain diseases, and between smoking and periapical periodontitis or gum disease is often noticed in smoking patients. Tobacco is by far the biggest risk factor for oral cancer. We cannot deny it. There is a strong dose-response relationship between smoking, tobacco, and development of pre-cancer. I told you, white lesions, red lesions, white spots, non-healing ulcers in the mouth due to smoking. Cigarette smokers are 5 to 20 times more likely to develop oral pharyngeal cancer than non-smokers, being the second cancer attributed to tobacco after lung cancer. So please stop smoking. So WHO has a framework for tobacco control known as Empower. What does it stand for? And Malaysia is part of this Empower Framework Convention on Tobacco Control, monitor tobacco use and prevention policies, protect people from tobacco smoke, either due to passive smoking or direct smoking, offer help to quit tobacco use, warn about the dangers of tobacco, enforce bans on tobacco advertisements, promotion and sponsorship, raise taxes on tobacco. But let me tell you, although the taxes have been raised every year, there are still people who can afford to buy the cigarettes. Tobacco control in Malaysia. Malaysia became a party to the WHO Framework Convention on Tobacco Control, FCTC, on September 16, 2005. Since then, many efforts have been conducted in our country on tobacco control using the elements of Empower. All these activities are regulated under the Food Act of 1983. But let me also inform you, all our Tanak campaigns by the Ministry of Health have been going on every year with a different theme. So please quit smoking. Quitting smoking helps to reduce the risk of oral cancer by 50% or 5 years. It should be noted that reducing cancer risk factors is the most effective tool in decreasing morbidity and mortality from this disease. There's no other way. Vaping is not an answer for tobacco control. The role of dental professionals in preventing smoking and encouraging patients to quit had not been taken into account until the last 15 to 20 years. Like I just told you before, when I was a dental student, it was not included in the undergraduate curriculum. But now it is part of the undergraduate curriculum where we have tobacco cessation lessons and tobacco smoking behavioral change. And several countries have developed ways to incorporate interventions against smoking in routine dental checkup. Why so? Because we dentists are the primary health caregivers. We are the person you come in contact when you come to have your dental checkup. So quitting smoking and reduce risk. How? Quitting smoking cuts cardiovascular risk. Just 1 year after quitting smoking, your risk for a cardiac arrest drops sharply. Within 2 to 5 years after quitting smoking, your risk for stroke may reduce to about that of a non-smoker. That's good news, right? If you quit smoking, your risk for cancers of the mouth, the throat, esophagus, and bladder drops by half within 5 years. That's good news. 10 years after you quit smoking, your risk for dying from lung cancer drops by half. So guys, quit smoking. So what's the take-home message today? Smoking is the #1 public health problem globally, not only in Malaysia. Tobacco control activities is strengthened by the Framework Convention of Tobacco Control, FCTC. Malaysia is a signatory to the FCTC. Dentists are important contributors to tobacco control efforts. Apart from oral screening, which is done routinely when you walk into the family dentistry clinic or any dental practice, we also screen you for oral cancer. So quitting takes hard work, a lot of effort, but you can enjoy your life. So please quit smoking. Thank you.